Hi and welcome. My name is Dr. Sam Sunshine, and today's video is going to be about the gut microbiome. I'm going to do my best to make it somewhat simplified. And what we're going to be talking about is this environment along our digestive tract that is a ecosystem that does a lot of amazing things, from helping us to detoxify foods and sterilize foods to helping break down food so it's absorbed and utilized by our body, and then how certain things can muck up the function of the intestines. Terms like leaky gut or irritable bowel syndrome may be terms you may have heard of. I'll talk a little bit about that and what we can do to start to heal the gut microbiome if we have symptoms that suggest that we have problems with our digestion. But it's a pretty miraculous and hard to fathom ecosystem that we call the gut microbiome. So I'm going to share my screen with you, and we'll get started. So the title of my talk is The Microbiome: Protective Microbes. So I'm going to start with a quote called, and it's optimal health is not a part-time job. So if you want to live a healthy life, I think it's important that you try to be focused on your health throughout the day, and not just thinking about your health a few days a week or a few days a month. And I hate to say it, most of us do that. And it's really something that, the big decisions you need to make every day are, what to eat for breakfast, what to eat for lunch, what to eat for dinner. How are you going to fit in exercise? How are you going to manage your stress? What time are you going to go to bed? And these are important things. How are you going to develop your relationships and be integrated into society? So again, it's not a part-time job. It's a full-time job if you want to live healthy. So the microbiome, what is it? So the microbiome is basically these microscopic bacteria, viruses, fungus. Mostly it's bacteria, many very different species that do different things, and they live in harmony within us or on us. So we have a skin microbiome, we have an eye microbiome, a throat microbiome, and then we also have an intestinal microbiome. And so when I'm talking about the intestine, I'm talking, the esophagus all the way down to the rectum or anus, and primarily the stomach, which helps to pour in a bunch of hydrochloric acid to help to sterilize things that we eat. And then our small intestine, which helps to digest food, and then our colon. And we have these microbes, and they are 10 to 100 trillion microbes. So I've heard that the number of microbes, or these bacteria, viruses, funguses that live within us, outnumber the cells of our body by 10 to 1, according to some people's estimates. And there are thousands of species of these microbes, and it's an ecosystem. And it gets started as we're infants. From the time we exit our mother's birth canal and begin breastfeeding, that colostrum is chock full of immunoglobulins, and it seeds our microbiome, and from there it grows. And we know that women who have C-sections will have children that maybe are more at risk for infections during the newborn period, because their immune function isn't as robust as someone who's had a vaginal delivery, or children who breastfeed. Compare those who don't breastfeed. As I mentioned, there's the variety of things. Now, again, there are good bacteria and bad bacteria, as well as good fungi and bad fungi. And so generally, a healthy microbiome has healthy species that work together to ensure good digestion and good health. When you have overgrowth or undergrowth of bad bacteria and you kind of wipe out the good bacteria, you can get symptoms like bloating, poor digestion, and it can manifest as other symptoms outside the intestinal tract, which I'll talk about in more detail. But basically, these organisms live symbiotically or peacefully with one another. And it's only when we do things that disrupt that delicate balance that we start to develop symptoms. And then we can try to recreate that ecosystem through eating certain foods, reducing stress, exercise, and avoiding some of the foods or medications that wreak havoc on our digestive tract. And what's interesting is each person's network of microbes is very different. What we see in let's say, in people who live in other countries compared to the US, and even within the US, depending on where you live in the country, people's microbiomes are very diverse. So it's important to know that. So again, we have microbiomes in different parts. So what influences the microbiome? Genetics, environment, what we eat, our lifestyle, hormone levels. And then we have a microbiome in our nose, our mouth, our lungs, stomach, colon, so forth. And it's really the human microbiome, we talk about the microbiome, is really an aggregate of all of these areas of these individual microbiota. And as I mentioned, these are the areas where we see it. And the purpose of these organisms is really to maintain the integrity of the lining. So the lining of our eyes, a conjunctiva, the lining of our intestines. It's a single cell epithelial lining. The same with our mouth and our lungs and our heart, which is a muscle. And there was that, these gut muscle connections. There's a gut heart connection, a gut brain connection that I'll talk a little bit about. And depending on what's happening in our intestines can influence what's happening in other organs. It's very important to understand that. So these microbes act as guardians, or they protect these epithelial linings from foreign invaders. So what are the benefits of a healthy gut microbiome? What's one of the roles this gut microbiome plays in maintaining our health? But it does function. These bacteria function as an extra organism. And some people say it's a second brain because there are more neurons that innervate or line the small intestine, the colon, and stomach, than are neurons in the brain. And that's basically all the brain is a compilation of neurons. So, a healthy microbiome is really important. Plays an important role in our overall health, in our mood, immune function. People have said that 70% of our immune function is within the intestines, the gastric associated lymphatic tissue. So super important. It helps regulate inflammation levels. Again, like I mentioned, it can affect heart health through the vagus nerve, which is one of the cranial nerves. It can also influence weight management. A lot of studies done in mice especially show that the type of microbiome you have in your intestines can dictate whether or not you're going to become obese or thin. And brain health and mood. And that's a big topic, this gut-brain axis. There's a lot of information in the literature, and it's been a big interest for the past decade or so in looking at how the gut microbiome can influence mood and depression and anxiety symptoms. So we'll talk a little bit about that. So again, the microbiome can affect our physiology, how our cells work, and the byproducts of what the cells do. So this slide in the middle, it says your gut microbiome. So again, we're kind of just looking at the gut microbiome. We're not talking about the other microbiomes we have in our body. But it can influence, if we look at the top at 12 o'clock, it influences our weight. Number 2 is at the 10 o'clock. It may affect heart health, and it absolutely does. Number 3, at the 2 o'clock position, helps control blood sugar. Number 4, it explains why people who have different responses to identical foods. Some people can eat, unhealthy food and they're fine. Other people are very sensitive to eating unhealthy. And number 5, at the 5 o'clock position there, again, affects mood. And I'll want to emphasize that I'll emphasize that more, but I want to emphasize that even now, that knowing that if you or loved ones have mood issues, it can be due to an unhealthy gut microbiome. And that's sometimes hard to grasp. We know that the bacteria that are in the small intestine help to make neurotransmitters. Neurotransmitters are these molecules that help nerves communicate. It does help protect the lining of the intestines. It also protects our body from infection. These invaders usually are sterilized and eradicated from the low pH in the stomach. And then the good bacteria tend to crowd out the bad bacteria, as long as you have good bacteria. And it seems to also, again, regulate metabolism. That's our ability to break down and utilize nutrients, and food absorption. And it helps to regulate blood sugar balance, as I mentioned. Hippocrates, who was a physician around 400 BC, a lot of people say that Hippocrates is the father of medicine. He has a quote that is oftentimes used in topics on the intestinal tract, and the quote is, "All disease begins in the gut." And it's very interesting, but a lot of, again, medical literature and interest is going back to looking at intestinal health, and that when you repair the gut microbiome, a lot of times symptoms, bad symptoms that you have, whether it's intestinal symptoms like bloating, diarrhea, or constipation, or if it's mood symptoms or heart or lung symptoms, can be improved by improving the gut microbiome. So one topic that comes up that is a problem with the gut is a condition called leaky gut. Now, leaky gut is kind of a term that is thrown around in the functional medicine world to help explain that the epithelial lining, the one cell lining that covers the inside of the intestines, can be damaged. It can either be damaged, the cells themselves, or the tight junctions, or the glue that kind of holds the bridges that hold the cells together can also be damaged. And when that happens, your gut becomes more permeable to foods and things that are in the gut. So on this picture on the right, these circles are things that are in the intestinal lumen, things that we ingest or inhale or swallow. And it could be dietary proteins. One in particular is a gluten family of proteins. Antibiotics, or really any medication. Some can be very inflammatory and harmful to the intestines. Infections. Again, we eat foods that can have bacteria and yeast and viruses on them. But fortunately, if we have a good stomach acid and a healthy microbiome, we can prevent those invaders or infections from getting into our blood system. And then talks about toxins and food allergies. And this last one down there is stress. So stress can impact our health and can deteriorate our gut lining. So we can see an increase in gut permeability or leaky gut if you have increase in stress. So these are the triggers that cause damage to that lining of the intestines. So food allergies, again, common things are gluten, dairy, soy, corn, sugar. Also food irritants may include coffee, processed food, which is the standard American diet, which 70% of Americans adhere to. Environmental toxins, insecticides, pesticides, herbicides, exhaust fumes, these estrogens, bacterial infections. Again, we inhale these things, or we can ingest them. Contaminated food. Again, medications such as ibuprofen is a big one. It can harm the intestinal lining. Antibiotics is another one that can really change the microbiome significantly. Even just a single course of antibiotics can have a very adverse effect on the gut microbiome that could take months or even years for it to recover. And again, stress, as I mentioned, this is just one article from the Current Opinion of Behavioral Science of 2019, stress, depression, and diet and the gut microbiota. Again, this is at the Ohio State University College of Medicine. Here's just another one in the Journal of Neurobiology of Stress, stress in the gut-brain axis, regulation by the microbiome. So just picking two, but there are really quite a few articles out there that talk about how stress can affect the microbiome and can also create and cause leaky gut. So what are the consequences of leaky gut? So what if we have it? And I'll be honest, I'm not really sure what percentage of people do have leaky gut. There is a test that we use, so blood test, to look at actinomycin, which if that's high, if we have antibodies against actinomycin in the blood, that could be a sign that the cells are permeable. And then there's occludin and zonulin antibodies we might have in our blood that show that those tight junctions are being broken down. Again, by those things that we talked about, food allergies, bacteria, toxins, stress, medications. And again, so what are some of the consequences? If you have a leaky gut, who cares, right? It can also, if you have a breach in that gut lining, it can also affect brain health. And so these toxins and pathogens can leak and get into your brain. And that's where there's that concern that it can be an increased risk for neurologic conditions, as well as mood disorders. It can cause systemic inflammation, autoimmunity. So a lot of autoimmune conditions can be improved by healing the gut. And you'll be hard pressed to find a rheumatologist or gastroenterologist that will support those claims, but it is clear that that's the case. Malabsorption and nutrient deficiency. So if the gut lining isn't functioning normally, you're not going to be absorbing nutrients, and we'll see nutrient deficiencies, and food intolerances. And so there are people who just can't eat certain foods because their gut is inflamed, not functioning normally. So again, this is the title of this slide is the gut microbiome is the communication hub. So again, this is going to be just talking about how the intestines communicate with other organs and these gut microbes. So we have the gut-brain connection, and this is where intestinal problems, or like gut inflammation, can create anxiety and stress. And then that stress can actually further worsen or weaken the gut microbiome, and kind of a vicious circle gets created. We have the gut-lung connection where intestinal problems are linked to asthma. That's just one example. We fix the intestinal issues and patients' asthma get better. And I've seen that multiple times in my own patients who have asthma. We get them off oftentimes just simple things like some of the food allergies that they have, and their asthma clears up. The gut-heart connection. We certainly know that poor gut health can be related and associated with conditions like arrhythmias, like atrial fibrillation. So improving gut health can improve heart conditions. And then gut-muscle connection. We know that if you have inflammation in your gut, it can affect muscle function. And again, there's plenty of research that supports this. This is just not a belief. So what are some of the symptoms of poor gut health? So about 65% of people in the US will have symptoms of gut issues or intestinal inflammation. It can be diarrhea, reflux, bloating. And most people just assume it's normal. That's just normal because I've been feeling it since I was young. Since I can remember, I've always had, occasional diarrhea, occasional constipation, occasional bloating, but these are not healthy to have these symptoms. So I like this slide. It could be increased heartburn, abdominal pain, gas, constipation. So again, bloating is probably one of the most common ones. When people have bloating, that's a sure sign that intestines are not working well. Again, gas can be one symptom as well. Usually it's people who just feel gassy all the time. Some foods can increase our risk for gas, like beans and cruciferous vegetables. But gastroesophageal reflux is so common. It affects a very high percentage of Americans. And most of the time, it's treatable by just modifying the food we eat and the amount of food we eat. Diarrhea and constipation. Again, fatigue can be a symptom of poor gut health. Rashes or allergies, again, nasal congestion or skin rashes. Sleep issues like insomnia. People who complain of brain fog or poor cognitive functioning. And again, as I mentioned at the onset, anxiety and depression or mood disorders can be a symptom of poor gut health. And then, of course, autoimmunity. One of the ingredients of developing autoimmunity is you need to have increased gut permeability or leaky gut, as well as a genetic predisposition and some trigger, which could be a medication such as an antibiotic. So improving gut health, again, first eliminate a lot of the food allergies. As I mentioned before, a lot of it's are going to be wheat, dairy, corn, soy, sugar. And for some people, even avoiding the nightshade families or glutenins and lectins for some people. And those are the beans and the eggplant, tomatoes. You got to be conscious of how you feel after each meal. And then there are also stool tests that can be done and blood testing to look at antibodies to these food toxins if they are in your blood. Also improving gut health, drinking, staying hydrated, exercise, reducing stress can help improve gut health. So again, avoid unnecessary antibiotics. This is a big part of my job, is to try to convince people they don't need an antibiotic for a stuffy nose or a cough. Antibiotics can really wreak havoc on the intestines for quite some time. Eat a wide range of plant-based foods and try to eat organic. Super important. Prebiotics. And prebiotics examples are going to be like chicory root and other types of root plants, and leeks as another prebiotic. And there's, and then probiotics, of course. And probiotics are basically different types of bacteria. There's a wide range of different types of bacteria. And probiotics basically are specific subclassifications of bacteria as well as yeast that help support the microbiome. They don't replace the microbiome, but they support the microbiome. Again, make wise food choices. If you know certain foods upset your stomach, avoid those foods. And avoid unnecessary medications. Again, I have a lot of patients who just take anti-inflammatories like Advil and Aleve on a daily basis because it just helps calm their joints, but it wreaks havoc on our intestines. And then magnesium can be used to improve gut health as well. So magnesium is a micronutrient that is necessary for a lot of enzymatic reactions in the body, and most adults have magnesium deficiency. So supplementing with magnesium can improve gut health. So when we talk about healing the gut, again, most of it is going to be avoiding these foods that are listed here. They are all the inflammatory foods. We want to improve our ability to digest food. So sometimes adding digestive enzymes, bile acids, taking out the pathogens. And the one way you would know that is by doing stool testing. And so we do a fair amount of stool testing in those patients who really have complicated illnesses, and those patients who have digestive issues or symptoms within their intestines. We want to rebuild the gut lining by providing healthy foods that nourish the gut lining. And we want to identify food sensitivities. And again, there's tests out there, specialty labs that can identify what foods we react to And those are foods we want to eliminate for a period of time from our diet and reduce stress. I think I've hammered that message home now. So again, the perfect diet, if we have the perfect diet, it still doesn't protect us against getting illness or having gut issues. Every person is different. And when we are treating conditions like gut inflammation or leaky gut symptoms, it's very individualized and very personalized. Again, the testing can help us guide treatment, but everyone's treatment will vary. We really want to address the underlying health issues first as well. Is it a blood sugar issue? Do you have an ongoing infection in the intestines that we're not aware of? So it's not uncommon that we'll see yeast overgrowth or overgrowth of opportunistic bacteria, call that dysbiosis. Or do we see overgrowth of Helicobacter pylori, which is a bacteria that lives in the stomach? So these are the things that we want to first identify and then manage. And again, another take-home message is that there's no quick fix for these conditions. They take time to create and they take time to heal. So it's not an overnight pill that most Americans have become accustomed to because of how doctors practice. There's a pill for an ill. So if you have a symptom, here's your pill. And we've got pills for IBS, we've got pills for reflux. But if we don't get to the core or the root issue of what's causing these symptoms, you're going to be taking those pills to treat those symptoms indefinitely. And that's really not the goal. The goal is to heal the gut so your symptoms go away. So there's a lot of protocols out there to heal the intestines. If you were to Google the 4Rs protocol, you'll see quite a few. Some people have the 5R protocol. Some people have an 8R protocol or an 8-item protocol. But just to go over the 4Rs, the first one is remove. So you want to remove allergenic foods, like we mentioned a few times. Again, that's the wheat, the dairy, the sugar, the corn, the soy. Again, it doesn't mean you have to give those up forever, but a lot of times it just helps reduce inflammation. You want to replace by adding digestive enzymes if necessary or bile acids and correct nutritional deficiencies. Do you have a deficiency in magnesium or B vitamins? We see that quite a bit. And then you want to re-inoculate with the probiotics and the prebiotics, as I mentioned before. And those can be very specific, and a lot depends on your symptoms and maybe the test results. Maybe it's a home stool test, or maybe you did an organic acid test to give us some information about that. And then the repair is really using specific nutrients like L-glutamine or deglycerized licorice to help heal and nourish the cells that line the intestines, are called enterocytes. So I'm going to recognize a few authors who've written books over the past decade or so that really highlight the association between food ingestion and our health. The first one is Peter Osborne, and this was a New York Times bestseller called No Grain, No Pain. And now he even has the Gluten-Free Society. I think if you go to glutenfreesociety.org, it's all of his information, but really healing people by just getting them to stop grain intake. Dr. Dale Perlmutter, he's a neurologist, and I heard him lecture, and he, in his lecture, said that in practicing neurology for 3 decades, never really able to help people until he realized the connection between food, primarily grains, and brain health. And now he lectures on that connection between grains and brain health, grain intake and brain health. And again, another New York Times bestseller. A book that I'm reading right now is by Michael Ruscio called Healthy Gut, Healthy You. And he basically summarizes what I said in my talk today, gets into some detail. Great speaker. I've heard him speak a couple times. And then this last one is mind-gut connection. So how the hidden conversation within our body impacts our mood, our choices, and overall health. So I think it's important to, if you're interested in digging a little bit deeper, is to, look at reading some of these books. Very informative, and can give you, again, some great examples of how you can feel better and improve your health by following basically the 4R protocol. So I'm going to just share a couple cases. This first one involves a condition called ulcerative colitis. And if you look on the right, and there's a normal colon, and this is a cartoon image, and then the ulcerative colitis, which you have ulcerations within the lining. And this is a 40-year-old male with ulcerative colitis, had been treated with quite a variety of different prescription medications over the years. We did a micronutrient test on him, and that revealed low B vitamins, low glutamine levels, low glutathione, low vitamin D, low selenium. So he really wasn't digesting or absorbing nutrients very well. We started him on a gluten, dairy-free diet with some supplements, and now he's off all his prescription medications. Again, it took about a year, and he went from being on 5 prescription medications for ulcerative colitis from his gastroenterologist, and basically said, you're going to be on these indefinitely. And now he's off all his prescription medications and doesn't have any more gut issues. We did a recent gut permeability test, and that was normal. Again, a leaky gut test was normal. The second case I'm going to share with you is a 29-year-old school teacher, and she would have these flare-ups of eczema that would affect her neck and her face and around her eyes. And so it became really unsightly, and she wasn't sure what to do. She would be put on courses of steroids and other medications to help control her symptoms. She did a home stool test and showed that she had an overgrowth of opportunistic bacteria. She had a high yeast growth and inadequate fat and protein digestion. It also showed she had high anti-gliadin antibody level, which is a gluten reactivity test. And she was treated successfully with just antimicrobials, a gluten and dairy-free diet, and some additional supplements to help support her intestinal lining, and her symptoms resolved. And then the last case, so maybe going back to that, this just to summarize with this last case, again, skin manifestation affected that was caused by overgrowth of opportunistic bacteria and yeast overgrowth in her colon. Now, what ultimately caused that is hard to determine, but we were able to diagnose it and to treat it, and it eradicated her symptoms by healing her gut. Third and final case is a 23-year-old female with food intolerances that most foods, and this happens to some people, they almost can't eat anything, but most foods, she get bloated and painful stomach. And she said, I have not felt well for a long time. And the home stool test, again, it's a kit you take home and then you send to the lab and they analyze it, revealed that she had overgrowth of unhealthy bacteria. She had a low immunoglobulin level, and she had evidence for gluten sensitivity. And again, gluten is one of the main proteins that's found in wheat products, flour, wheat flour. She completed the 4R gut protocol along with a gluten and dairy-free diet, and her symptoms improved significantly. We later addressed thyroid issue that she had and gave her a thyroid replacement, and now she feels well. She's able to tolerate foods that she hadn't been able to eat for quite some time. Again, she does need to maintain that gluten dairy-free diet because those are 2 of the foods that she reacts to. So I want to thank you for listening. And I hope this was helpful to help you better understand how important it is to have a good, healthy gut microbiome. There are ways we can measure it. And if you do have symptoms of intestinal upset, or heartburn, or some of the things we talked about, bloating, there are ways to treat it other than medications to treat specific symptoms. So thank you for listening.